All right. Well, with all these fires burning across Canada, by the way, there are about 1,000 right now from coast to coast, but hundreds of them are in British Columbia. And we know also Alberta being affected and the ones in the Northwest Territories. It means there's a lot of concern over air quality. And take a look. These are air quality statements that have been issued by Environment Canada, warnings and statements. You can see that it is moving eastward over the next couple of days. Right now, it's in the lower part of British Columbia, parts of southern Alberta, as well as parts of southern Saskatchewan. But the statements are in effect for huge swaths of our country across northern Alberta, northern Saskatchewan, northern Manitoba, through Ontario, yes, into Quebec. And it's in fact going to stretch towards New York City and over Ottawa, no doubt as well, coming up, and into the Maritimes by later this evening. Dr. Shawn Aaron is a respirologist at the Ottawa Hospital with a lot of experience when it comes to air quality. Dr. Aaron, thanks for taking some time for CTV today.
My pleasure. Thank you, Todd, for having me.
Yeah, so we're showing our viewers that map. We're following these wildfires, unprecedented in our country. What is the takeaway here for you as a doctor and someone who specializes, in respirology? You know about air quality, you know what smoke can do.
Yeah, the takeaway here is that people are at risk, especially people who are vulnerable, those people who have a history of chronic lung disease like asthma or COPD should be avoiding this wood smoke if at all possible. Similarly, pregnant females are at risk, and the elderly. The bottom line is that it may be unavoidable, but as much as we can, we have to try to avoid inhaling these particles because they really can cause horrible health effects in all people.
Yeah, and I know, a lot of people, a lot of us, Dr. Aaron, still have face masks as a result of the pandemic, sitting at home and whatnot. I mean, do they provide any sort of protection? Face masks, dust masks, whatever the case may be?
Well, realistically, the paper face masks and the cloth face masks don't do a lot. The best face mask to use if you're going to use one would be an N95 face mask, because these are going to actually filter out 95% of the small PM 2.5 particles that get deep into the lungs and that can be absorbed into the bloodstream. So my advice is if you are outside and exposed to this wildfire smoke, please do wear an N95 face mask.
Are there other ways, Dr. Aaron, that people might be able to protect themselves? Let's say they are in some of these higher risk areas of our country right now.
Well, the obvious things to do, if you can do it, are to go inside, close all the windows, turn on your air conditioning. If you have an air purifier or a HEPA filter at home, turn it on. And try not to inhale any of the obvious smoke that's going to be in the air. For those who are evacuating, it's obviously much more difficult because they can't avoid the wildfire smoke. But if you are evacuating in a car, what you should do is turn your air conditioner on and keep your air recirculating within the car. Don't draw outside air into the car filters.
That's a good tip. What are the long-term implications, though, for exposure to this kind of stuff? What do you think?
Well, in the short term, the obvious things that happen are that people may experience coughing because of aggravation of the upper airway mucous membranes. Their eyes may water, their nose may run. That's all short-term mucous membrane effects. But in the long term, these wildfire particles can get deep into the alveoli, which are the areas of the lung that we use to breathe, and then get transmitted into the blood. And that unfortunately creates systemic inflammation within the body, which can lead to an increased risk of heart attacks and strokes and blood clots. And these inflammatory effects can actually manifest weeks after the exposure, so that if you're exposed to these things, you're actually at an increased risk for bad health effects for weeks after the actual event.
Dr. Aaron, I know you're joining us from Ottawa and the smoke is moving in your direction. Have you ever seen anything like this before in your experience?
Well, 3 months ago, yeah. In June, we had similar events because of the wildfires in northeastern Quebec. And the air came down to Ottawa and then, of course, went to New York City and Washington and other states in the U.S. But before 3 months ago, this was unprecedented. I can't remember in my experience ever dealing with health effects of wildfire smoke in Ottawa. And now this is unfortunately something I think we're going to have to contend with as healthcare providers, perhaps every summer for the next upcoming years.
Dr. Shawn Aaron with the Ottawa Hospital joining us from the capital today with his expertise. Respirologist, thanks for this, Dr. Aaron. Much appreciated.